Hello again. The CDC is holding an emergency meeting this week to talk about heart problems being reported by teenagers after getting the COVID vaccine. Dr. Jonathan Aliota with Kelsey-Seybold Clinic is live with me now. Doctor, thanks for your time. From what I understand, there have been nearly 800 unconfirmed cases of heart problems reported, about 200 of those in patients under age 30 after the Pfizer shot. So is this more than was expected, and perhaps is this not as rare as we first reported?
Good morning. Thanks for having me on. I don't know that we have such long-term data. I mean, as we are rolling out the vaccine in a more widespread fashion to more and more people, of course, we're going to see more adverse reactions come through. So I don't know that this is more or less than we expected, but certainly we're continuing to collect the data.
And to be clear, we don't know if this heart condition is actually related to the vaccine or not, right?
That's exactly right. I mean, I think what's confusing is that we do see that heart condition, myopericarditis or pericarditis, which is, just an inflammation of the heart. We see that with COVID infection. So I think it's a little confusing because certainly there are people who have undiagnosed COVID who then get the vaccine.
So who is most at risk for this? Is there a certain age group, a certain demographic?
The data is saying right now it's mostly being seen in teenage to younger men. Ages 16 to 24 is the group that currently has a little spike in this reported incidence of cardiac inflammation.
And is this cardiac inflammation, is this just a temporary condition? And what are signs that you might be suffering from it?
Signs include shortness of breath, some mild chest discomfort, especially when breathing or leaning forward. 90% of the time, or maybe not 90, but often, this is completely recoverable, and people are supported with anti-inflammatory medicines like different versions of ibuprofen, fluids, and other just normal supportive measures, and people recover completely.
So good to know that it is temporary, there is treatment available. What should you do if you begin to notice some of those symptoms?
Well, of course, there is the vaccine adverse effects reporting system that anybody can access. And I think if you've had a vaccination and you're feeling something unusual, it's always a good idea to use that system, because this is how we're gathering our data and this is how we're learning more about the vaccine.
And doctor, finally, what's your message to parents who are still on the fence about whether to get their children age 12 and up the vaccine?
So far, the data looks really promising, and I think that the concern is that that age population is still the targeted population where the COVID virus is growing, and we're still having a hard time controlling infection rates in that age group. So as summer comes up and camps come up and activities come up, I think it's something we have to look at really closely to try to get rid of this virus in our population.
Okay, and we wait for that younger population, 2 to 11, possibly sometime in September is what we're hearing. So we'll wait for more on that for the younger age group to be approved. Thanks, doctor. Appreciate it.
You're welcome. Thanks for having me.